Hi, my name's Andrea. Welcome. If this is your first time here, I hope that you enjoy my channel and what we have to say. And if you are returning, thank you so much for coming back. What I do here is I talk about what it's like to go all the way through your 20s and all the way through your 30s, child-free or child-free by choice, and then having that abruptly changed and deciding to have a child at 40. So for me personally, I was very career oriented, very driven, and then when I finally became 40, decided that I wanted to change the trajectory of my life and decided to have a child. And what I talk about is what it's like, the emotional, relational, and I guess psychological, social changes that also come along with that, but from a very personal perspective. So today what I want to talk about, and I'm just kind of spitballing this one, is I have been diagnosed, I guess you would say, with a Velamentous cord insertion. So what does that even mean, and how does that impact whether or not I can still have a at-home birth and delivery? So a Velamentous cord insertion is when the umbilical cord doesn't insert into the placenta itself. It actually inserts it when you read about it, it'll say into the membranes. But what the heck are the membranes? The membranes are the amniotic sac. So instead of having an umbilical cord that inserts into the placenta itself, it inserts into the amniotic sac, and then it has these little tendrils of vessels or blood vessels that then find the placenta, and that is how the baby is fed. It's a devastating diagnosis if you have what's called vasoprevia. Forgive me, I don't know all the terms perfectly. And what that means is if the vessels actually go over what's called the cervical os, or where the cervix would be opening during delivery. Because what would happen is the amniotic sac breaks, and if you have blood vessels that are in the way or in the area of the break of the amniotic sac, it could rupture those blood vessels, and then the baby is no longer getting oxygen or nutrients. You know, it's only super scary. So I've had 2 ultrasounds done, and they say that the the Velamentous cord insertion is greater than 2 centimeters above the cervical os. And apparently, this greater than 2 centimeters measurement does not disqualify you from an out-of-hospital birth, but it does mean their risk is a little bit higher. I've been reaching out to my midwife, my previous midwife, my current doula, and doing a lot of research either on Google, a lot of ChatGPT, to try to tell it to direct me towards peer-reviewed articles, because I've looked into some of the other resources that I've used before, like evidence-based birth and some of the other ones, and I just haven't found a whole lot of resources or information on Velamentous cord. It doesn't mean that it doesn't exist, it just means I haven't found it. So that's really it. Is I have an interesting diagnosis. This happens in about 1% of pregnancies. The complications that would usually come with it, I haven't really experienced, which could be, you know, a slow and fetal growth. My baby's growing just fine. I'm currently 39 weeks and 4 days pregnant. Holy moly. So she's growing just fine. Her heart rate is fine. Her oxygenation is fine. Like, everything so far about my pregnancy is wholly unremarkable, except for this Velamentous cord. What I thought was interesting is they only tell you whether or not it's more or less than 2 centimeters above the cervical os, or above where the cervix would be on the inside of the uterus, but they don't actually take a precise measurement. And apparently 2 centimeters is the cutoff for lower-ish risk versus catastrophic risk. But I am curious why, if they can measure 2 centimeters, why not say greater than, greater than 2 centimeters, but likely less than something. So I don't know, so people could make more informed choices. So anyway, that's what I'm wrestling with is, okay, so I have this thing. Do I go to the hospital for it? If it was less than 2 centimeters, it's an automatic C-section, but I'm nervous to go into a hospital setting just because I know there's a lot of things in a hospital setting that that just make me nervous. Like the propensity to not delay cord clamping, or they only delay cord clamping by a minute when studies show that longer than that is more beneficial. I also know that doctors and nurses, although probably wonderful people and got into this profession and into the birth world for all of the right reasons, have time constraints and certain protocols and certain probably metrics they're trying to meet. And I don't want my provider thinking about their metrics. I want my provider thinking about me and my birth. So that's just me just kind of thinking out loud. I can't really tell you, I don't have a ton of research on Velamentous cord. I can't really tell you anything about it other than they do exist and that I'm still debating on home birth or not. Now, at this point, I'm not in labor right now, so I can certainly pivot and have a hospital birth, but I'm nervous. The idea of, I would be nervous to go into a hospital just because I don't want interventions I don't need. I don't want to deliver on my back. I don't want continuous fetal monitoring. I don't want to be told or asked to push before my body is ready. I don't know. So, and maybe this is too much of an overshare. And I don't want to be encouraged to get an epidural. I don't want to be encouraged to get Pitocin. I only want interventions that are absolutely necessary. So, anyway, I'd love your thoughts or comments or feedback or, I don't know, anything you have to share. I really appreciate it. Bye.